Okay, good morning, good afternoon, good evening everyone saan man pong panig ng mundo na kayo naroon. Welcome to our 117th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community, and for all those who have just discovered us today, welcome po at sana po tuloy-tuloy na po ang inyong pagtangkilik sa ating programa. HIV is a major global public health issue, having claimed 40.1 million lives since 1981. And when the first published report of what would ultimately become known as the HIV and AIDS appeared in June of 1981, very little details were known about the disease. It did not have a name, it was not clear what caused it, there were no tests or treatment, and patients rapidly died within a few months. Fast forward, prior to COVID-19 pandemic, the Philippines had one of the highest rates of increase in HIV in this part of the world. So for today's episode of the Stop COVID Deaths webinar series, we will take a closer look at an epidemic that occurred prior to and continues to grow during this time po na nasa pandemya pa rin po tayo. Na Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Fridays, no, with our credible online community. And usually at this point, I will introduce my partner, si Dr. Susie. However, Dr. Susie is on a flight back to her home base. So for today, co-hosting with me and keeping the seat warm for Dr. Susie is Assistant Vice President for Public Affairs and the Director for the Office of Alumni Relations of the University of the Philippines System. She is also a faculty member of the UP Diliman Extension Program in Pampanga. Please welcome again to your screens, Professor Rica Abad. AVP Rica.
Hi. Hey, good afternoon, Doc Raymond, and welcome to all our participants here in the live broadcast of Zoom webinar, and to all those watching via live streaming on the TVUP YouTube channel, as well as on all the Facebook pages no, ng ating UP system, ng Stop COVID Deaths at ng TVUP Facebook page. So, syempre, no, special shout out po na ako sa faculty of the UP Diliman Extension Program in Pampanga. Parati silang nanonood, lalo na ang mga nasa clinic namin. Okay, so kamusta na ba ang ating mga ka-Fridates? Thank you to everyone who continue to send us inspiring messages and for answering the exit surveys. Your inputs are greatly appreciated, most especially your suggestions for future topics. Keep them coming po. Syempre, we always aim to offer you timely and relevant topics that are interesting to you. As Doc Raymond has mentioned, si Doc Susie will be back next week. But please stay and keep us company today. We have an exciting lineup for you. And speaking about exciting, Doc Raymond, we have an exciting announcement for everyone. Congratulations to our Stop COVID Deaths team and to our entire online community for this third award. Doc Raymond, we have been honored. Yes. We have been honored with the International Gold Quill Award of Merit, the Philippine Quill Excellence Award, at gayon naman, the Asia Pacific Silver Quill Award of Excellence. At lahat ito dahil po sa inyong lahat. Maraming salamat for all your hard work and for all our viewers who continue to watch us. Okay, so as we have seen on our opening billboard, we have transitioned to broader discussions on how the pandemic has affected health outcomes beyond COVID-19. So we have maintained the title Stop COVID Deaths, but now the COVID is an acronym. So the C stands for current COVID-19 problems, the O for other outbreaks, V for viruses, I infections, D diseases. So ang Stop COVID Deaths natin ngayon ay nagle-level up na po to take a closer look at other emerging health problems in the community, while we keep an eye on COVID-19 developments here in the Philippines and in the rest of the world. And since we know that you like to always be abreast of the latest news in health and medicine here and abroad, we have a segment in the webinar called News Updates.
Okay, AVP Rica, for our first news update, and this is very recent lang po, no? The World Health Organization's Director General recently mentioned that the end of the COVID pandemic is in sight. Please watch this short video.
Last week, the number of weekly reported deaths from COVID-19 was the lowest since March 2020. We have never been in a better position to end the pandemic. We're not there yet, but the end is in sight. We can see the finish line. We are in a winning position, but now is the worst time to stop running. Now is the time to run harder and make sure we cross the line and reap the rewards of all our hard work.
Thank you, Dr. Tedros. For that statement po, no, that represents quite arguably the most upbeat assessment of the World Health Organization patungkol po dito sa COVID-19 pandemic declared as an international health emergency in January 2020. This is something that even though a lot of folks have been looking forward, it doesn't mean natapos na po tayo. In that statement also, Director General Tedros urged countries to be able to maintain their own vigilance and likened the pandemic to a marathon race. 'Di ba nabanggit po niya yan we should still run harder, make sure we cross the finish line, etc. So all of these really go into how we will be going out of the COVID-19 pandemic. What about you, AVP Rica? Ano pong balita?
Well, for me, I'd like to talk about this New York Times article, The Future of Hospitals, Flexible Space for the Next Pandemic. It discusses about, during the early waves of the pandemic, where it was revealed that our intensive care units are without enough beds, and we had to even set up overflow tents in parking lots. Because of this, many hospitals are remodeling with a philosophy of flexible design, with the idea that spaces should be adaptable for different purposes at different times. So we have some examples in the article. Now they gave the example of the Rady Children's Hospital in San Diego, where designers created an X-shaped floor plan with 60 beds that can be converted into 20 fully isolated rooms for infectious disease patients. Another example given was the new ICU at Doylestown Hospital in Pennsylvania that has private rooms meant to flex between intensive care and step-down care. Their rooms are clustered in pods of 8 to reduce traffic in corridors. So good ideas, ano? And finally, isa pang example yung hospital, the Barnes Jewish Hospital in St. Louis, Missouri, where they have acute care rooms that can morph into ICU rooms. To achieve that flexibility, designers included additional outlets for medical gas and electricity and larger clearances around beds to accommodate extra equipment. So for their hospital rooms, the upper half of the doors will be made of glass to allow practitioners to observe highly contagious patients without having to enter the room. So eventually, these pandemic modifications for flexible hospital design may be integrated in the building code in order to build a resilient nation. So that's the news from my end, and that's the latest news update from Stop COVID Deaths.
You're on mute, AVP Rica. Sorry.
Back
Okay.
to our webinar topic for today, no? We're talking about the human immunodeficiency virus, or HIV, no, which targets the immune system and weakens people's defense against many infections and some types of cancer. The most advanced stage of HIV infection is acquired immunodeficiency syndrome, or AIDS, which can take many years to develop if not treated, depending on the individual. The AIDS is defined by the development of certain cancers, infections, or other severe long-term clinical manifestations. So, Dr. Raymond, let's listen to what the people on the ground are thinking.
Sexually transmitted disease na kapag hindi nagamot, inaatake niya yung immune system ng isang tao hanggang ma-weaken ito.
Commonly nakukuha, hindi ako nagkakamali, sa most commonly through sexual activities, through unprotected sexual activity.
Ito ay isang virus na nakukuha sa pakikipagtalik ng higit sa 2 o 3 na iba-ibang partner.
It's a disease na nakukuha sexually or through blood transfusion or exchange of bodily fluids, mga ganun bagay.
Usually, na-associate with gay people, pero that's the stigma na dapat nating itigil kasi na it's very harmful and it's very dangerous na ganun yung thinking.
Tayo ang makaiwas sa HIV, kung aktibo man ang ating usaping sexual, siguro lagi tayo ay gumamit ng protection.
For me, I believe nag-start with proper information, correct information about HIV.
Kasi 5 years ago, even 10 years ago, yung messaging ng campaign was abstinence, which I think hindi siya practical to say that. And we have safe sex, which is the use of condom.
Yung talaga, practice safe sex talaga, use condoms, ganyan. Ayun.
I think wala pa talagang cure ang HIV. And it's been a long, long time na hanggang ngayon naghahanap pa rin ng experts na cure for that. But that doesn't mean if you contract HIV, you can't live a normal life anymore.
Dapat katakutan ng HIV, hindi yung disease itself. Yung stigma, discrimination towards sa mga people na may HIV. Marami pa rin naniniwala actually na HIV can be transmitted sa hugging, kissing, saliva.
Those, alam na ang status nila for those person living with HIV. Laban lang kasi andito tayo, mga advocates, to help you and guide you along the way. It's very important na magpa-test tayo regularly. There are available testing facilities in every city, I believe.
Ngayon, 2022 na, marami ng research, marami ng studies, may mga gamot na rin. Hindi na death sentence ang pagkakaroon ng HIV. So, as long as you know your status and as long as may gamot ka na ARV, you'll have a happy life.
Thank you very much, TVUP, for giving us the pulse of the people. Our healthcare practitioners are very knowledgeable about many things, but these are not necessarily trickled down to everyone. No, we have communication campaigns and everything, no, but sometimes, di ba, Doc Raymond, hindi naabutan lahat. So we hope that this Stop COVID Deaths webinar will contribute to HIV awareness. Doc Raymond?
Thank you, AVP Rica. Just a little bit of a housekeeping po, no? Certificates of attendance will be given to those who have watched at least 50% of the webinar duration. So marami na po nagtatanong kung bakit hindi po sila nakatanggap. If you feel you should have received your certificate, and especially since we have distributed from 1 to webinar 115, meron pa pong konti-konti na lang po for webinar 116, but hopefully over the weekend matapos na po yun. But if you feel that you should have received it pero hindi po kayo nakatanggap, please feel free to email us at stopcoviddeaths@up.edu.ph so we can check our databases po. AVP Rica?
All right, so let us now proceed to the topic at hand for our webinar. In this episode of Stop COVID Deaths, we will discuss the most recent information on HIV, prevention, treatment, and new literature. Doc Raymond, baka you want to tell everyone about our discussion format for today?
That is true. For today's webinar, we will be following our standard panel discussion format. We have a set of speakers doing their presentations followed by a Q&A session. So we will be entertaining questions coming in from the Zoom. Kung meron na po kayong katanungan, please feel free to put them in the Q&A box in Zoom. But if you are in Facebook or YouTube, we will also be scouring the comment section and trying to select which ones are most relevant. So, yun po. If you have anything else na kailangan, gusto nyo pong itanong pero nahihiya po kayo, but so please feel free to ask them in the comment section if you're outside of Zoom and in the Q&A po in Zoom. AVP Rica?
Okay, but before we delve into the webinar, I know everyone is very excited about our fun quiz. So here we have a cute intro for a fun quiz segment for all of you.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Trucy, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Thank you very much talaga sa ating animation from the TVUP team. Before we delve into our questions, we would like to join those who are joining us outside of Zoom. If you could open your browsers and type in slido.com. And when you are prompted, enter the code 5405717. That's 5405717 for you to be able to participate in our fun quiz. For today's fun quiz, medyo unorthodox po tayo in a sense kasi apat po ang ating katanungan. Madali lang naman po. For our first question, paano nahahawa sa HIV? So, is it through blood transfusion? Is it through mother-to-child transmission? Needle stick injury? Sexual intercourse? Or lahat? Lahat ng nabanggit. So, we really encourage everyone to participate pa dito sa ating fun quiz. For our second question, nagagamot po ba ang HIV? So, I think may mga sagot po medyo kalahati po, no? Almost 50-50 nagsasabi na yes at nagsasabi po ng no. I'd like to take this opportunity to greet those who are joining us from Malinao Treatment and Rehabilitation Center in Albay, from the Western Visayas Medical Center in Mandurriao, Iloilo City, Maria Estrella General Hospital Incorporated in Calapan, Oriental Mindoro, from Kuta Major Cesar L. Sangan Station Hospital in Pagadian City in Zamboanga del Sur. I saw also in the chat those who are joining us from Ward 1 of the Department of Medicine ng UPPGH. Salamat po. From Rizal Medical Center, from the New Sinai School and Colleges, from the House of Representatives. Thank you po sa patuloy na pagtangkilik at panonood. Meron din po tayo joining from the Department of OB ng admitting section po nila, UPPGH. Thank you so much. From Davao City, the Southern Philippines Medical Center. Thank you. Who else? From Rizal, from Cavite, from Isabela District po. Maraming salamat. The Regional Office of Tuguegarao, Region 2 in Dept, Department of Education. Okay, meron din po who are joining us from the University of Santo Tomas, our regulars from the Center for Kidney Diseases. Those from Angel Salazar Memorial General Hospital in Antique. Thank you po. Those who are joining us also from Cavite, from where else? Batangas, okay, from the Ecosystems Research Development Bureau ng Department of Environment and Natural Resources. It's located within the UPLB campus. And also, those watching from the UPLB campus, thank you po. From the National Teachers College, who else? Those from SPMC Emergency Room, from Marilao, Bulacan, from Santa Rosa, CHO1, yung COVID lab po nila, University of Rizal System Health Services. Maraming salamat po sa inyong lahat. From the Philippine Red Cross ng Muntinlupa, the University of Cordilleras in Baguio City, and UPPGH 4th floor, right central block 2. And Dr. Jose Rizal Memorial Hospital in Dapitan City, Zamboanga del Norte. For question number 3, when taking antiretrovirals, at what point are HIV patients most likely no longer infectious? Is it at 2 weeks? Is it at 1 month? Is it at 6 months? Or is it at 1 year? Okay, please feel free to put in your answers po, no? Marami po ang nag-gravitate towards, I think, 6 months, both in Slido and in the Zoom. And for our final question, bihirang magka-HIV ang mga kababaihan. Ito po ba'y totoo o ito po ba ay hindi totoo, true or false lang po. We'd also like to greet those who are joining us internationally from the Chonan Hospital in Taipei City in Taiwan, the University of Hail in the Kingdom of Saudi Arabia. Thank you. From Dubai, United Arab Emirates. From International SOS in Luanda, Angola. Thank you so much. Lunichi Ali, University of Blida 2 in Algeria. Our regulars from the University of Fiji in Lautoka, Fiji. And finally, from the University of Waikato in Hamilton, New Zealand. Thank you so much. We will not be closing for the meantime our fun quiz as we move on po to our webinar proper, and we hope this one is really helpful for you and full of nuggets of wisdoms and is insight po for all of you to be able to pick up. EVP Rica?
Okay, so I know that everyone is excited to get this discussion underway. So let's introduce the first of our two presenters for this webinar. The first one, she is the Division Chief of the Infectious Disease and a Clinical Associate Professor with the Department of Obstetrics and Gynecology at the UP College of Medicine. Some of you may remember her when she was the discussant during our virtual grand rounds in episode 16. Ang tagal na nun, Doc Raymond. About the COVID negative mother who gave birth to a COVID positive baby. So please give a warm virtual welcome to Dr. Sybil Lizanne R. Bravo. Doc Sybil.
Good afternoon po. Good afternoon, everyone.
Hi, Doc Sybil. So wonderful to see you again. Dalas-dalasan mo naman ng bisita sa Stop COVID Deaths.
I'm honored to be part of the Stop COVID Deaths again.
Yeah, so Stop COVID Deaths family na yan, si Doc Sybil. I think si Doc Sybil has a presentation for us today, no, Doc?
Yes, I do.
So yeah, we'll wait for you to share your screen.
Let me start.
Opo, go ahead.
Okay, so good afternoon, everyone. My title is Living with HIV, What to Do. This will be the outline of our lecture. We'll define HIV, the symptoms. We'll discuss management, the complications. And of course, we'll deal more with what's happening now with this particular infection, especially this time of COVID pandemic. So the HIV, of course, stands for the human immunodeficiency virus. It is an infection that would really attack our immune system, specifically while lowering the CD4 cells, part of the white blood count. So it can weaken our immune system. As such, we can have some other infections such as tuberculosis, fungal infections, and other bacterial infections. Now, yung sa ating kanina, Paul, it was asked if there's a cure for HIV. Well, there's no cure for life for HIV, but there are many drugs now available to, fight the virus from multiplying and to maintain a healthy immune system. But the HIV does not really go away. It's not really treated, but we can suppress its production in our immune system. So with proper medical care, the complications can be prevented, and HIV affected people, both males and females, can live long and healthy lives. So there are two types, the so-called HIV type 1 and HIV type 2. The most common is type 1. These are the risk factors. So medyo na-discuss na po ito kanina. Of course, having multiple sexual partners, meaning if we have more than one sexual partner, unprotected anal or vaginal sex. Of course, if we have any others STI, that would increase our risk of acquiring HIV or other STD for that matter. And of course, through sharing of needles or blood transfusion. And if for healthcare workers, if we accidentally prick ourselves with needles that are infected with HIV, then we can have the infection. Kaya maingat po dapat tayo. For the symptoms, these are actually protein symptoms. So just like any other virus, para pong sa COVID lang, one can have fever, sore throat, night sweats, chills because of fever, fatigue, and some could have rashes or muscle aches. There are 3 stages of HIV infection. The first of which is called stage 1. It is acute stage, wherein there's a large amount of HIV in the blood. And some people can be symptomatic, but some might not be symptomatic at all. Stage 2 is chronic HIV infection. This is actually called the asymptomatic stage or clinical latency. Kahit tahimik ito, HIV is still very active and it can reproduce but at very low levels. So patients may not have symptoms at this time. So stage 3 is the so-called AIDS. So ito po yung alam natin na term, no? AIDS, Acquired Immunodeficiency Syndrome, wherein, of course, this is a late stage. People usually have severe damage to their immune system. That's a time that they can have the so-called opportunistic infections, which we will discuss later. So the WHO, the World Health Organization, recommends that every person who is at risk of acquiring this disease has to be tested. And every person should be educated not to seek comprehensive and effective prevention, testing, and therapy services. Well, for some good news, many tests are very available now. It's well available in our hospitals, even in private laboratory centers. But we should, though, follow the 5 C's in offering testing. That's, of course, securing consent, honoring confidentiality. Of course, we should counsel our patients well, pre and post test. And of course, we should give the correct results and we should be able to connect them with further care services. For the diagnosis, of course, as we have mentioned, for high and low burden HIV settings, HIV testing should be offered to all who are at risk for this disease. Okay, so sabi nga natin, marami nang yung nag-offer na center. At least every person actually, especially in high income countries, should be tested on an annual basis and yearly for HIV. There are 2 types of testing, the so-called conventional, and we have now the rapid HIV diagnostic algorithm, which we are now applying in our local setting. So ang difference po nila, yung sa conventional, after a reactive antibody screen, so it's just a blood test, we request for the Western blot assay, but we send the specimens to other RTM or SACL. Kaya po, the turnaround time is about 1 month. It's because of the volume of samples that they are receiving. But for the rapid diagnostic algorithm, to sum it up, these are a combination of 2 or rapid diagnostic antibody antigen tests that are done in parallel or in sequence. So after obtaining a positive antibody screen, the patient would now go this rapid test. And if positive for 2 or 3 of these tests, then the infection is now confirmed. So turnaround time is very, very short. No? Maiksi lang po kasi these are just antibody-antigen reactions. So ito po mahalagan that we discuss the techniques of disclosure. If we got a negative result, it doesn't mean that the patient is not at risk anymore. So if she or he is at risk, we should continually, of course, offer support, give advice on how to prevent HIV, and still if very, very acceptable on patient or their families, of course, we advise them to have repeat tests if they are at continued risk of acquiring HIV. For those who are positive for the antibody, of course, we tell them that we have to confirm yet with another confirmatory test. So yun na po yung diniscuss natin kanina. And again, if they turn out to be positive, then we have to prepare for disclosure. This is the hardest part actually. I have been into some disclosure sessions. Naku, it took us about 2 to 3 hours. Siyempre, nandyan po yung mga iyakan, sisihan. But we have to educate well the patient and their families about the disease. First, we tell them, it's not the end of the world, no? Hindi naman. But, of course, some are shocked. Hindi sila makapagsalita, and many people have really had breakdowns, they cry before us. We tell them that HIV may not be fully treatable, but there are many drugs now and centers that could really help them and their families. And most importantly, we have to link them to HIV care. So again, good news, marami na ba tayo ngayong mga HIV hubs that can give free medication, refer to other specialists as needed, and of course, screen the partner or partners, emphasize the importance of starting on the different drugs, and if pregnant, of course, we take care of their pregnancy, and we refer to OB. to the OB-ID specialist or to OB generalists who are knowledgeable in taking care of these patients. So how do we screen HIV in pregnancy? There are four-pronged approach to eliminate, hindi lang po prevention ngayon, is EMTCT. Dapat na po elimination of mother-to-child transmission of HIV and improvement of maternal health. So for women of childbearing age, again, we should be able to discuss the primary prevention of HIV. For those with HIV, of course, we have to take care of them when they do become pregnant. And when they are pregnant again, we should discuss the strategies to prevent or to eliminate maternal-to-child transmission. So these are the 6 steps of cascading the elimination or the prevention of mother-to-child transmission. So during prenatal checkup, we all offer HIV screening for all pregnant individuals. We discuss advantages and disadvantages of doing this technique. And next, of course, when positive, as I've mentioned, we do offer the different drugs. We discuss techniques of how do we take care of them during their labor. And of course, the mode of delivery is very, very important to discuss with the patient and her family. And of course, we discuss infant feeding options, and of course, we'll link them to care to pediatric services. So the approach that we are using in offering that test is the opt-out approach. So we state that these are the laboratory exams that we need to do because you're pregnant, and added to that is screening for HIV. So parang ito po yung advantages. Of course, if we know that you're positive, then we can take care of your baby. We can prevent a transfer of the virus to your baby, and of course, take care of the whole family. So yun po yung advantage. And according to many international guidelines, including our own POGS and our own OB-ID Society, again, we do emphasize screening for HIV at the first visit. And for some very high-risk individuals, we do advise repeat screening at the 3rd trimester. So what do we do now for an HIV woman who is in labor? She's about to give birth. Siyempre, kailangan natin discuss kasi COVID pandemic, meron pa rin tayong mga restrictions. For the pregnant woman with HIV and with full COVID vaccination, that means she has 1 booster shot and has been asymptomatic for the past 7 days, there's no more need to do COVID testing. Ayan. So, pag negative for COVID, dun siya sa non-COVID labor room. Pag positive, meron tayong dedicated, we have dedicated COVID labor room and DR delivery room. For those with incomplete vaccination, meaning wala siyang booster or wala siyang primary series ng COVID vaccine, or kahit she's fully vaccinated but she has been symptomatic, we need to do COVID testing. So, in addition po dito, we now accept antigen testing. So we discussed during the prenatal checkup that they could actually undergo vaginal delivery as opposed during our time when we were doing fellowship under Dr. Manalastas and our other senior consultants. Lahat po ng pasyente ng sinisias namin. But now, the latest guidance, and we have, of course, the technology for testing, we now offer vaginal delivery for HIV women who satisfy certain criteria if they have low viral load and they have been for the anti-HIV drugs for at least 4 weeks or 1 month. Ideally, we should repeat the viral load testing near term para malaman natin if they have low viral load. Kung less than 1,000 copies per ml, then they could safely undergo vaginal delivery. In the practice of the essential interpartum newborn care, before we cut the cord right away, ayaw natin expose si baby kay mom. But now, we can do modified EINs. It's essentially, again, properly timed cord clamping, at least 1 to 3 minutes. Hindi natin kagad separate ang baby, And we just dry the baby thoroughly, and we now advise immediate skin-to-skin contact. Regarding breastfeeding, we now highly encourage breastfeeding among our HIV mom and baby dyad. Unlike before, we are now much into bottle feeding, formula feeding. But if patients, again, are on low viral load and they have been on ARV for at least 4 weeks and they are well educated, we now highly encourage breastfeeding at least for the first 6 months of life and up until 12 months with, of course, supplemental feeding for the infant. So for the management, again, the treatment depends on the stage. That's why we discussed the different stages of HIV early on and the presence of other infections as well. Of course, the primary goal is to prevent the immune system from deteriorating that much or from the person to get the different opportunistic infections, which are actually very, very hard to treat in some cases. So we emphasize that the mainstay of treatment, of course, are the different HIV drugs, and we give prophylaxis against opportunistic infections depending on the CD4 count. And of course, one of our goals is preventing further deterioration of the patient's immune system and to prevent the stage 3, that's AIDS. Okay, so we have different consolidated guidelines. Of course, the ones that we are following are the ones from WHO. Mahaba po ito, but the emphasis here is that once diagnosed, these patients have to be started right away on antiretroviral agent. How do we monitor response to therapy? Well, ideally po, we should do viral load testing, of course, to check if they are responding well to the initial drugs that we are giving them at least every 6 months. If they are stable, then pwede na pong yearly basis. And also, we monitor the CD4 count, CD4 cell count, to monitor, of course, their immune status. So what are the complications? We have cardiovascular and other non-related cancers, such as Kaposi sarcoma, cervical cancer. These are all age-defining cancers. Bone problems, of course, hepatic disease, diabetes, lung, renal disease, and other cognitive disorders. As studies have shown that those who are not maintained on ARV or not very compliant, they have further cognitive decline, with time. Other complications, as I've mentioned, are having cervical cancers or different cancers, especially for those who are, not really very compliant with check-up, with follow-up visits, and other cancers such as lymphoma and the so-called wasting syndrome. What are the strategies to reduce non-AIDS events or complications? Of course, we should always advise them early initiation of treatment, stop smoking if they're smoking, of course, limit alcohol intake, maintain healthy lifestyle, diet, exercise, and control their other comorbidities. Now, looking to HIV in the Philippines, my emphasis here is that, as mentioned by Dr. Raymond early on, and Ma'am Rica, we have the fastest growing HIV epidemic in Asia. So that's really some bad news. The estimated number of people living with HIV will triple by in about 8 years from now, it's 2030, and reach more than 230,000. So that's really bad news. And to share with you from the latest DOH HIV registry in our country, we have about 1,300 cases in 1 month, that's last July. So average po natin, mga 40 to 42 per day new cases. May time pa nga po na overtake ng HIV ang new COVID cases in our country. And the top 4 regions are, of course, here in Metro Manila, Calabar Zone, Central Luzon, and of course, the Visayas region. So these are different modes of transmission, the common of which is, of course, male-to-male contact. Meron pong mga paisa-isang mother-to-child transmission. Ayan. And the newly diagnosed pregnant women for July were 8. So this is our PGH experience. We picked in year 2019, just before the pandemic, we had 40 patients, in 1 year. And now in the pandemic, medyo bumaba, but ang tingin po namin kasi this because of decreased testing and delivery, in tertiary centers. Now, how about HIV now in the HIV situation now that we are in this pandemic? We have noted that there was lower condom use in the general population, but amidst community restrictions, there was still sustained high level of high-risk behavior, such that, again, we have continuously been saying the numbers of HIV are growing but hidden. So yun po yung delikado talaga. Obviously, there were disruptions to service delivery and uptake, increased treatment gap, which we have to fill up and to close, no? Because essentially the primary care facilities and including the tertiary care institutions were really converted to COVID hospitals. Kaya po talaga nag-decrease ang testing. And again, for some sad note, even treatment initiation decreased by about 28%. Included in that is that the treatment gap towards achieving the 1990 accomplishment decreased to 68%, no? With the treatment coverage steady at about 61%. So yung viral load monitoring for testing reduced to 17% in 2020. But for some good news, the suppression rate, no, among those tested remained high at about 94%. So added to that, yung sabi nga po natin, the sustained behavior, decreased prevention coverage, the wider treatment gap, accelerated new infections. Kaya tayo na talaga ang with the highest epidemic in Asia. But again, working hand in hand with all of you, with all healthcare providers and those who are trained, we should be able to achieve these plans to help decrease and please prevent this epidemic to become really the worst in all history of all infections. So we should achieve the goal of reversing the trend of new infections by reducing new cases to sana po no, less than 7,000 new infections by this year. Tingnan natin sa by December pag ma-achieve po natin ito. We should be able to achieve the 95 plan of WHO and our own DOH. It means 90% prevention coverage, 90% diagnosis, and of course, 95% treatment coverage. So as I've mentioned, all in all, we should work hand in hand from the government sector, community sector, of course, our own LGU. Medyo sabi nga po, the end is near for COVID. So we should resurrect our services for HIV care facilities and diagnostic, together with our civil service sectors, we should be able to reverse the HIV epidemic. Thank you very much for listening. Good afternoon, everyone.
Okay, thank you so much, Dr. Bravo. Maraming salamat po. Very comprehensive and practical from that perspective po. So, we really appreciate it and we hope you'll be able to join us later on sa Q&A session. Just to remind everyone that the Q&A session po, no, as mentioned, we always choose naman yung upvoted questions. But really, we encourage everyone to start typing in your questions already in the Q&A of Zoom as well as in the comment section of YouTube and in Facebook. For our next presenter, first time po natin siya makasama. She is the Medical Director of the Sustained Health Initiatives of the Philippines, or SHIP. Please welcome to your screens, Dr. Kate Leyritana.
Thank you, Dr. Sarmiento, for the introduction. I'd like to thank TVUP for providing me the stage today to share a topic that is not often discussed, but is, I think, equally important. I'd like to commend Dr. Bravo for giving us such a comprehensive picture of HIV. Now, I want to explore HIV in women. So, isa po itong journey na pag-uusapan natin. We will backtrack a little bit on the history because I believe that in order for us to be able to prevent catastrophe, we should learn from our past. So, the objectives of my talk is to discuss the epidemiology, the factors that increase the risk of HIV in women, and the issues unique to women living with HIV. So magsimula naman tayo muna sa epidemiology. Gaano po ba karami ang mga kababaihan na may HIV sa buong mundo? So currently, there are 20.2 million girls and women living with HIV. And we can see here that the biggest proportion when we talk about geography, of course, is in Africa. In fact, Sub-Saharan Africa, which represents about 70% of the world's HIV population, 56% po ng mga people living with HIV doon, ages 15 to 24-year-old, are kababaihan. So sa kanila, mas marami pong babae ang may HIV kaysa lalaki. At alam po natin na ito ay taliwas sa ating sariling epidemiology na kung saan lalaki ang mas marami. So ito po ay dahil Africa has a generalized epidemic na kung saan sa general population po ang representative ng drivers of the epidemic versus sa atin na isang concentrated epidemic na kung saan ang mga key affected population ang usually ang most at risk. Kamusta naman ang kababaihang may HIV sa region natin, no, sa Asia and the Pacific? So here we see that only 2.1 million as opposed to the total of 5.7. Dito na po natin makikita ang effect ng isang concentrated epidemic dahil majority ng mga bansa sa Asia and the Pacific ay ganito po ang klase ng picture ng kanilang epidemiology. So dito po makikita natin na mas marami ang kalalakihang mayroong HIV. Makikita po natin throughout time naman na ang prevalence or ang women living currently with HIV kahit kailan pa sila na-diagnose is steadily, slightly increasing pero parang nag-plateau na siya, okay, throughout the years. Kumpara sa rapid rise nito noong late 90s and early 2000. Kamusta naman ang new infections among women sa Asia Pacific after a steep incline again in the late 90s? Nag-decline na siya ngayon. So hopefully this means, at least in Asia Pacific, that we are seeing less HIV new cases among women. Sa deaths po naman, good din po na makakita din tayo ng decline. So decreased deaths but sustained prevalence means women living with HIV in the Asia Pacific are living longer thanks to our modern medicine. Okay. Tignan naman natin sa Pilipinas. Napakita na to ni Doktora kanina. Gusto ko lang po i-emphasize ang females only comprise 6% of new HIV cases in the month of July. Yun po yung latest natin na HIV number. We can see here that males are still the predominant new cases sa atin. Often, females may represent yung tinatawag nating diagnosed at pregnancy. Now, sabi ko po sa inyo kanina, pag-uusapan natin a little bit about our history. So ito po ang latest data na cumulative number of cases sa Pilipinas. Makikita nyo po dito na nagsimulang magbilang ng HIV cases noong 1984. Pero nung time na to, medyo retroactive to kasi 86 na document pero kumbaga nag-retroactive reporting na lang noong 1984. Noong unang panahon, up until 1991, majority po ng ating mga kaso ay kababaihan. 62% of the 213 were females. During the early years, often our cases were from people who had exposure abroad. Pero starting 1985, nagkaroon na po tayo ng steady increase of HIV cases from our female commercial sex workers who initially had clients from countries with high burden of HIV. Pero sa kinalalaunan, nagkaroon din tayo ng ating local endemic transmission. Fast forward po tayo sa 2007. Dito po nagkaroon tayo ng tinatawag na sexual flip na kung saan naging majority na ng ating new cases ay mga kalalakihan. And currently, ngayon, 95% of our new cases have been males. Now, sa mga kababaihan natin, important na makita na 96% sa kanila were within reproductive ages of 15 to 49 years old nung sila ay na-diagnose. Ang implication po nito ay maaaring maapektuhan ang kanilang mga future na mga anak kung sila ay hindi ma-enroll into care. So gusto ko lang po i-emphasize that we have an opportunity to create an HIV-free generation as long as we practice prevention of mother-to-child transmission. Lalo na kung nandun sa reproductive age ang ating mga newly diagnosed na kababaihan. So ito po yung konting history ng ating HIV. Alam nyo po ba na ang ating mga libreng antiretroviral therapy na na-enjoy ngayon ng ating mga kababayan ay dumating lamang noong bandang 2001, 2002. Okay? Noong early times, noong 1984 hanggang 1991, wala po tayong kagamutang available locally. So ang nangyari po ay ino-observe lang natin yung natural history of HIV. So i-share ko po sa inyo ang isang study na ginawa noon na kung saan 53,000 female commercial sex workers from 2 areas in the Philippines ay nag-undergo ng multi-year seroprevalence survey. Ibig sabihin po nito, sila po ay sinubaybayan, no? Taon-taon mula 85 hanggang 92. Nagte-test po sila sa STI at HIV. Ang HIV test po ay annually. Sila po ay nakaregister sa local government unit at nagre-report sa kanilang social hygiene clinic para sa bi-weekly STI tests, which is very commendable, no? Ibig sabihin, hindi lamang na nasusubaybayan natin ang ating mga at-risk na female, na aalagaan pa natin sila, care of our social hygiene clinics. So during this period po ng pag-seroprevalence survey, nakakita na out of 53,000, 72 po ang naging HIV reactive. At lahat po ng ito ay nakuha from vaginal sex with heterosexual men. Maaring kanilang mga kliyente or kanilang mga sexual partners like karelasyon, asawa, partner, etc. Ang age range po nitong mga 72 na reactive ay from 16 to 32 years old. Yung interval po mula nung nalaman nila na sila ay HIV positive hanggat sa kumonsulta sila sa doktor para magpatingin ay 4 months. So kung isipin mo, napakalaking delay, no, ng time na yon. Ano kaya ang mga factors about it? Hindi po natin alam. Pero currently po kasi, we really encourage na kung pwedeng on the same day na malaman mo na ikaw ay HIV positive, tayo po ay magpa-link to care para agad-agad tayo mabigyan ng gamot. So ito, medyo malas nga lang nung panahon nila, wala pang gamot. So siguro wala sila masyadong positive health-seeking behavior para magpatingin ng mas maaga. Nang kinompute ang duration ng pagiging positive nila bago magpa-test, so from exposure to possible HIV to the test na mag-reveal na positive is about 6.7 months. So you can imagine, during this duration of having an unknown HIV status, if unprotected po ang ating mga encounters, maaari nating mag-transmit ng HIV sa iba pa nating kliyente nung time na yon. Ang kanilang baseline CD4 was high at 783. Ito po yung measurement ng health ng kanilang immune system. Maganda po itong score na to na 783, mataas. Ito ay equivalent sa isang HIV negative na person. So, bakit naging mataas ang kanilang CD4? It's because they test annually and therefore, kahit may 4 months or 6 months na lag, early diagnosis po yan. And hopefully, we can learn from that, no? Kung maging practice natin not only among females but everybody else na magkaroon ng yearly or regular, even every quarter if you are very active, na HIV test, mas maaga mo malalaman ang status mo, mas may magagawa ka, mataas pa ang level ng iyong immune system. Hindi ka pa makakaramdang ng mga complications ng HIV before you even get linked to care. So, among those na naging reactive, more than half, okay, progressed to an advanced stage of HIV or what we know as AIDS after 10.6 months. I saw kanina sa chatroom na may nagtanong, no, how long do you develop no opportunistic infections if you remain untreated? So remember, these women were untreated. So sa kanila, 10.6 months. But we must remember that this depends on what kind of strain or CRF or recombinant factor that you have. Kasi meron tayong mga fast-moving na HIV na kung saan itong progression from HIV to AIDS ay umiikli, no? In as much as 3 to 3.5 years. So, we must remember, sorry hindi po ito months, years po pala yan. Pasensya na, ang bilis naman nun. So, dati, di ba, parang 10 years pa bago magkaroon ng AIDS. Pero ngayon, due to some certain strains, pwede siyang umikli. And we have diagnosed this or have seen this in the Philippines. No? Ang interval naman from diagnosis to death ay among those who were AIDS, who had AIDS already, was about 15.9 months. Among the 13 na nakitang merong AIDS. So ang kalungkutan nito ay wala tayong nagawa nung time na yon, but to document what happened to them, we must be thankful for the availability of medications currently and the fact that they are free. So sana ay mag-take advantage tayo sa fact na yon and i-maximize natin. Okay. So now I want to talk about currently ang female representation in groups. Itong mga groups na to ay maaaring key population groups or groups lang in general. No? So una is among those who engage in transactional sex from the period of 2012, so later na siya to 2021, 3% ang female. So again, this demonstrates the flip that happened post 2007. Among OFWs, 12% ang babae na mayroong HIV, and sa youth from 15 to 24 years old, 4%. Among those who inject drugs or PWIDs, 6%. So in general, hindi masyadong marami ang female representation among our key affected population. On a side note, among our pregnant naman, among our pregnant, sabi nga kanina, 8 pregnant women were diagnosed with HIV in the month of July with a median age of 26. Mula nung 2011 hanggang currently, we had a total of 681 women diagnosed with HIV while pregnant. So malaki-laki rin ang ating mga opportunities to prevent mother-to-child transmission. So I hope that it resonates with the healthcare providers we have here today who are taking care of pregnant women to please recommend an HIV test when you see them for the first time. It's an opt-out thing, but we can always nudge them in the right direction upang sila ay makapag-intervene tayo ng mas maaga. And from January 1984 to December 2021, 246 infants were diagnosed. Ito yung mga missed opportunities natin to prevent mother-to-child transmission because they already were HIV positive. So ang tanong, given yung mga numbers na yon and yung mga kumbaga maliit na representation ng mga kababaihan sa ating mga key affected population, are women in the Philippines less at risk for HIV? So ayon sa isang pag-aaral ng DOH, no, nag-interview sila ng mga kababaihang living with HIV noong 2020. The risk of Filipino women for HIV is an interplay of factors which include sexual behavior ng kanilang partner, and the lack of knowledge on HIV prior to diagnosis. Ito yung naging disposition ng survey na yon. Una, regarding partner sexual behavior, may mga kababaihang alam na ang kanilang mga partners ay nakikipagtalik din sa iba, mapababae, mapalalaki. So aware sila sa high risk of acquiring HIV ng kanilang partner at merong ibang not aware. But among these two groups, they found out that HIV awareness was inadequate prior to their diagnosis, and their prevention and knowledge skills were inadequate at the time of interview. So these were 47 women living with HIV from 2016 to 2018 na kanilang in-interview. Nag-KII po sila nito. So we want to ask, bakit ganon? Bakit ganon yung picture na parang may lack or inadequacy of awareness and practice of protection? In a nutshell, ang mentality ay no risk, no test. Remember po, ang kababaihan sa Pilipinas is not in itself a key affected population. Ang key affected population po na siyang tinuturing na drivers ng isang concentrated epidemic ay sa Pilipinas, MSM, so gay and bisexual men who have sex with men, transgender women, people who inject drugs, and people who work in sex work. So yan po yung mga cap natin. So yung mga females who don't fall under those categories don't really find themselves at risk or admit to themselves that they are at risk. And therefore, they're also not direct targets of prevention strategies kasi kumbaga nagfo-focus tayo dun sa key affected population natin kasi sila yung, kung maka-impact tayo dun, buong Pilipinas, maaari bumaba ang population. So, kung wala masyadong prevention messages for females, less ang awareness and therefore less inclined to undergo testing. Lalo na sa subset ng mga hindi alam ang sexual habits ng kanilang partner or ang HIV status ng kanilang partner. So ang nangyayari po is ang desisyon nila na magpa-HIV test ay magiging based ngayon sa partner's health status. Kung ang kanilang partner ay umabot sa puntong nag-opportunistic infection na po dahil sa advanced HIV, that will serve as a trigger for them to also, because they are our sexual partner, magpapatest na ako kasi meron siya eh. Diba? So sometimes, females will present late in HIV. Makikita mong may advanced HIV na rin siya, mababa na rin ang kanyang CD4 count, baka may OI na rin siya. Okay. Pangalawa, makikita natin na ang mga kababaihan have difficulty coming to terms with HIV dahil sa maaaring implikasyon ng diagnosis sa kanilang pamilya. Therefore, they would be secluded and self-stigmatized. Okay? So, hindi na sila mag-access ng service. Pangatlo, women had lower treatment initiation and retention rates compared to the males. So, what are the reasons for this? Again, multifactorial. Sabi nga nila, ang mga kababaihan compared to males have multiple burdens, no, when it comes to HIV status. Pero sa mga kababaihang natuloy din, no, sa pag-seek ng care sa kanilang HIV, they were motivated by the responsibility they felt to survive and live longer for their families. So sa mga na-interview ng mga sa KII na ito, hindi lang sarili ang iniisip ng kababaihan upang mag-decide na mag-undergo ng treatment, pero ang kanilang pamilya as well. Now, let's talk about the status of HIV knowledge among Filipino women in general po ha. Hindi lang po ito sa HIV sa women living with HIV, no. Ito'y mula sa National Demographic and Health Survey noong 2017. 94% have heard of HIV. Narinig. So it doesn't equate to correct information or helpful information, but at least narinig nila. Hindi alien ang word na HIV. But only 1 out of 4 will have comprehensive knowledge about it. Saan ito galing? Anong ginagawa nito? Anong pwede mong magawa about it? 43% know na pwede mong ma-prevent ang mother-to-child transmission, no? Either sa pag-inom ng gamot or other things. So, ibig sabihin, more than half believe if the mother is pregnant, automatic the baby is pregnant. And if you have that mentality, baka hindi ka na mag-invest, in interventions. So we have to change that. And the sad thing is that 71% of Filipino women during this survey harbor stigma towards people living with HIV. Ang question yata dito is, kapag ang nagbebenta ng gulay ay may HIV, bibili ka ba sa kanya? And kapag ang batang may HIV ba ay dapat na mag-aral sa isang eskwelahan kasama ng mga ibang bata. So depende sa sagot sa dalawang tanong na yon, ina-assess kung merong stigma towards HIV ang kababaihan. Napansin na ang factors that increase stigma is lower economic status in life. So kung mas nakakaangat ka sa buhay, mas kaunti ang stigma mo towards HIV. And I don't know, but maybe that means a higher level of education and awareness. Ito namang sa map na to, here we can see yung percentage of women who know that HIV can be prevented by using condom via geographical status. So, alam ito ng mas maraming tao from CAR, no? CAR ang highest score, followed by Region 12 and Region 8. O NCR ay 68%. Okay, what about practice naman, di ba? So knowledge yung kanina, ang practice naman. Among Filipino women, only 0.4% had multiple partners in 1 year. 9% reported that they used a condom in their last sexual encounter. 4% reported ever having an HIV test and knowing the results. And almost half knows where to test. For the practices, it's quite dismal with regards to condom use and testing behavior. No, definitely much effort needs to be done, no, about this. So we need to increase the awareness and also access to condom. Okay. Ito po naman ang percentage of women who knows where to get an HIV test. Okay, so mga matataas ang score, region 6. Okay, 6, Mimaropa, 12, and NCR. I guess it helps if you have a lot of HIV testing places near your region. No? So, okay. Now, I want to spotlight on a certain key affected population na kung saan women are well represented, no? And these are female sex workers. This picture is what we call the condom lag. Okay? Na makikita natin na among sex workers, they report that their first vaginal sex with a male occurs at 18 years old. However, if you look here, their first condom use occurs 2 years after. So there's a gap of 2 years of unprotected sex wherein interventions may be done, but transmission probably went on. This is the same thing seen among males, especially MSM and transgender, but kumbaga, you move that further to the left kasi they start earlier, no, at 16. But still, it's a 2-year gap between initiation of sex, kumbaga, 2 years mula nung pumasok ka sa gera versus na-realize mo wala ka palang sandata, no? Doon ka palang naggumuha ng shield and barrel para lumaban sa gera. So, what we want to see is opposite. Kailangan ready yung ating mga at-risk na population before they even go to war. So, this can be done if we provide awareness, education, and this is a call to action to our education department to please do include STD and HIV informal education in our younger children para it can translate into action when they are sexually active. Going back, female sex workers in the past 30 days, 81% of them had a new client, 75 had sex with returning clients. They also have sex with their partners, be them boyfriends or husbands, and they have an average of 7 clients per month. 4.2% of the respondents reported engaging in chemsex or the use of drugs to facilitate pleasure during sex. 18.6% were forced into having sex. So there's an element of no consent here. Assault or rape. 1% engaged in anal sex and 16.6% engaged in group sex. Ang kagandahan na nakita ko, and I don't know if this is because of the good practice from the 1980s to 1990s, mas mataas ang condom use ng female sex workers versus all the other key affected populations across the board. Okay? We would like it to be 100%, of course, pero this is actually much better than the rest. And kudos to the program which instilled this, and I hope this can be sustained and practiced pa rin. And these are the other statistics that are important. And if you see here, they are recipients of information on HIV, and they do use forms of family planning, super high rates of ever getting tested for HIV, and better rates compared to kanina of tested in the past 12 months. So again, subset po ito ng kababaihan, female sex workers. Himalayo po ito sa kaninang pinakita ko na kababaihan in general, no? So mas maganda yung ginagawa na ating mga sex workers with regards to prevention practices. All right. Pasadahan ko lang po ang mga concerns, medical concerns unique to women living with HIV, gynecological health issues, especially sexually transmitted infections, increased risk of cervical cancer. Cervical cancer, especially the invasive type, is an AIDS-related cancer. Increased risk of comorbidities. Kumpara sa babaeng walang HIV, mas mataas ang prevalence of comorbidities among women living with HIV. Women versus men in general, mas mataas ng konti. Having more than 2 comorbidities, mas mataas din. And polypharmacy, which follows because that means you take more medications. HIV medicine side effects and drug interactions are a concern, and aging-related issues including menopause. Ano po ang implikasyon nito sa mga healthcare providers ng mga kababaihang may HIV? kailangan po aware tayo about the influence of HIV and the gender or sex on comorbidities. Kailangan po natin ng more targeted screenings, and kailangan ang healthcare natin is holistic and hindi po focus lang sa HIV and that's it. We have to look at the whole person. Isang magandang progress ay ang pagkakaroon natin ng U equals U. Isa po itong campaign na kung saan ang paggamot ng isang taong may HIV ay siyang prevention na po for transmission. Kung ang PLHIV ay nagiinom ng gamot at nakitang suppress ang kanyang viral load, hindi na po siya makapanghawa through sex sa kanilang partner kahit na wala pa itong condom. The risk of transmission is zero. It's important to explain this to your patient. Not only will it improve adherence, but it also relieves them from the guilt of being the source of HIV for all their partners. Okay. Another issue that is kind of unique, no, to women living with HIV are mental health concerns. And in a survey done among 150 women living with HIV, 97% of whom got HIV through sex, 3 from injecting drugs. Ito po yung prevalence ng mental health concerns. 1 out of 4 had depression, 23% had anxiety, and in the last 12 months, 28% had suicidal ideations. Moderate levels on all types of HIV-related stigma were seen in all, and ito po yung mga domains ng mga yon. This means mental health should be integrated even in primary HIV care. So kung hindi pa po natin ito ginagawa or nire-refer natin sa iba, at least mas-screen man lang po natin ang ating mga pasyente. I mean, not only among women, but all PLHIV, you should have integrated mental health services. Okay? At sa mga women living with HIV, ano po yung mga naging coping styles nila sa mga stress nila sa buhay? Nalaman na mas marami ang emotion-focused coping style using acceptance, social support, humor, positive reframing, and spirituality versus the other coping styles which are problem-focused and avoidant. Okay? Sabi daw nila, taliwas po ito sa international data na kung saan mas nakikitang problem-focused ang mga kababaihan in coping with HIV. So ano kayang meron ang Pilipinas? Bakit emotion-focused yung ating mga survey respondents? Ang naging social support ng ating women living with HIV, nakitang mataas. Okay. From moderate to high social support ang mga na-interview sa pag-aaral na ito. At ang source ng kanilang social support, significant others or partner in life, family, and friends. So ano pa ibig sabihin nito? Marami sa kanila ang nag-disclose ng kanilang status sa kanilang family, friends, and significant others at nakatanggap ng social support na siyang naging way for them to cope. Okay? Kahit na nakaramdam sila ng anxiety, depression, and suicidal ideation. Ito po ay, I think, aking second to the last slide na kung saan importanteng makita ang complicated intersection ng framework ng how HIV affects women living with HIVs and their family. Para maintindihan natin ang kakaibang burden na bitbit ng kababaihan, meron tayong psychological impact, physical health impact, intimate partner violence, social impact, na kung saan kasama ang stigma and discrimination, family separation, divorce, child-parent conflict, and impact on children's social life and education. And last, economic impact on women living with HIV and families. Ito po ang binibitbit sa shoulders ng ating mga kababaihan when they find out that they have HIV, and that's why their actions are dictated by the implications on all these. So ang way forward po natin, no? Puro problema yung binanggit ko, sana po ito yung way forward natin. On the left side, we have what we call the cascade of care. 2 ways po ito. Una, ang HIV treatment side para sa mga diagnosed with HIV at ang HIV prevention side sa mga nag-test na negative. Meron po tayong pwedeng gawin sa bawat step. Ideally, hindi masyadong malaki yung gaps in between para hindi masyadong maraming nawawala sa ating health system, no? So ito po yung mga efforts, and hopefully we can find interventions at each cascade to retain our clients or patients in care nang mapangalagaan natin sila. Ano po ang mga ways na to? Ito po lang ay aking personal recommendations. Una, i-increase po natin ang access ng ating kababaihan sa education, combination prevention strategies, prevention of mother-to-child transmission services, and to treatment. Okay? Access. Pangalawa, when in care, magbigay po tayo ng high quality of care na holistic, na titignan ang buong katauhan ng ating mga pasyente. At pangatlo, dahil nakita natin na importante ang support system for coping sa mga kababaihan, we should provide adequate support systems and consider yung role ng ating kababaihan sa pamilya sa mga recommendations natin. Dahil kapag kababaihan ang ating pinag-uusapan, hindi lang siya ang involved but the whole family niya, lalo na kung sila ay mga ilaw ng tahanan. So ako'y magpapasalamat po sa inyo for this time. I'd like to thank the women who have paved the way until now. Ito po nasa picture ay si Sarah Jane Salazar. Siya po ay namatay noong 2000 sa panahong wala pa tayong gamot sa Pilipinas. Ngunit kita natin dito na siya ay humarap sa publiko, nagbigay ng kaalaman tungkol sa HIV at ginamit niya ang kanyang sarili upang mag-spread ng awareness. So kung hindi dahil sa mga kababaihang tulad niya ay baka hindi tayo makarating sa ating kinaroroonan ngayon. So, and there are a lot of unsung heroes who will remain nameless, and we would like to thank them. So again, salamat po ng marami.
Wow, thank you very much, Dr. Kate. Ang ganda-ganda ng very, no? Very comprehensive.
Galing.
Dr. Kate, sabi nga ni Dr. Kate, hindi, Doc Raymond, no, hindi sapat lang na awareness. Kailangan comprehensive knowledge. So ayan na, sa presentation ni Doc Kate, very comprehensive ang kanyang presentation na kasama pa yung points of strategy, no, sa interventions and cascade of care. So Doc Kate, please join us later sa Q&A session, ano? And mamaya may surprise pa sa atin si Dr. Kate kasama sa ating panel discussion. So now we will be hearing from our reactor, no, Doc Raymond. We are very pleased to have with us a professor of Obstetrics and Gynecology at the University of the Philippines, Manila. Please give a warm welcome to Dr. Ricardo Manalastas Jr. Doc Butch. Doc Butch, kamusta na po? Yeah.
Thank you for having me to the presentations. It's my pleasure, and I'd like to commend my colleague, my colleague in the department, Dr. Sybil Bravo, for her presentation. Concise but complete, no? I think for everyone, very useful. Unfortunately nga lang, because of COVID, as she mentioned, some of the services that we offer, not just we, when I say we, the whole system, no, that we offer for HIV patients, had to take a parang backstage. Kaya siguro, sabi nga niya, bumaba, no, yung services, pati yung people living with HIV accessing services, including the critical ARV, yung antiretroviral therapy. Explain na rin niya no, na ito critical kasi yun, no, yung to be regularly on ARV to live a practically normal, healthy life. Nabanggit din niya, no, walang, sabi natin, cure. Kasi doon sa poll, tinatanong, nagagamot ba ang HIV? Kasi walang masyadong accurate translation. And I'd like to emphasize this, no? Maraming nagsasabi, walang cure. Pero, emphasize natin, no, that doesn't mean you don't go for the medications. Kasi, well established, with the medications, you live a practically healthy life, sabi nga nila. And you can enjoy whatever activities your life you people will go into. Yun ang pinaka-critical. But of course, it starts with people getting tested. Kasi unless you're tested and you don't know your status, you don't get into the system of HIV care. And I'm glad may nagsasabi din, no, our other speaker. Ako, OB din ako, no? So I empathize with the plight of women kasi I'm directly involved in their care. Hindi naman totally marginalized sila in many things, including HIV care. Pero many of the patients that we see, at least kami siguro ni Dr. Sybil, no? Kasi OB nga, most of these women, you know, they just have one lifetime sexual partner. And some of them, they end up getting HIV. So I'm not saying that all the time it is the male partner who brings home the virus, but it can happen, sabi nga nila. No? So hopefully we can improve on that also. Dun sa mga nabanggit na strategies and programs, tanggalin yung stigma attached to people living with HIV, regardless of their sexual orientation. The thing is, I'd like to emphasize as a reaction, and I'd like to reinforce yung sinabi ni Dr. Sybil kanina, no? Avail of healthcare services for HIV. They're available locally. No? And siguro yun ang pinaka-main message ko by way of reaction to the presentations. And I'll be happy to, you know, if I can, answer some of the questions that may be fielded. So yun lang muna for me. No? So thank you very much for having me again here.
All right. Thank you very much, Dr. Butch. Dr. Raymond.
Thank you, Sir Butch. Thank you so much. We have half an hour to go, and we hope to be able to gather all of the troops, so to speak, as we move ahead with our panel discussion. So at this point po, no, we want to be able to ask our speakers, Dr. Leyritana and also Dr. Bravo, to open their videos po. We will begin our Q&A session shortly, but before we begin and go into our panel discussion, we'll take a very quick break for our special public service announcement for today.
Ay, ate, gusto ko nang lumabas at makipaglaro.
Eh di ba magkakasakit daw tayo kapag lumabas?
Magpe-face mask naman ako eh.
Kahit na, hanggat wala daw tayong injection, hindi tayo pwedeng lumabas at maglaro.
Ano ba yan? Takot pa naman ako sa injection.
Huwag ka mag-alala. Parang kagat lang daw ng langgam yun.
Talaga? Eh natatakot pa rin ako.
Eh di sabay na lang tayo.
Pa-injection?
Oo, syempre. Loves kita eh. Para makapaglaro na tayo.
Dahil mahal ko kayo, magpapabakuna ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center.
Yeah, thank you very much, TVUP and Stop COVID Deaths team for that PSA. No, that the PSA is one of the many creative outputs to push for pediatric vaccination for children aged 5 to 18 years old. Dr. Raymond?
Thank you, and we hope you'll be able to share this message as well as this video clip in all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. So we also understand that everybody is very busy. We have selected a few presentations po and tried to make them very consumable, so to speak. And we lovingly call them as SCD Shorts. You'll be able to watch them at your own convenience at the TVUP YouTube channel. So if you just need to go to youtube.com/TVUPPH for you to be able to see all of these short videos. And again, these nuggets of wisdom from each of them. Okay, let's start the ball rolling, AVP Rica.
Okay, I think see Dr. Kate. Dr. Kate, don't you have a special guest for us during our Q&A?
Yes.
Dito na ba si Ma'am Elena Felix?
Yes, I think I see her, AVP Rica. Yep.
Yes. Welcome po. Dito si Nanay Ellen. Yan, si Nanay Elena. Si Elena Felix is
Hello po.
hi, kamusta po? She is with the Association of Positive Women Advocates Inc. or APWY. Yan. Kamusta po?
Magandang hapon po sa lahat. Ako po si Nanay
Magandang
Elena Felix.
Hello. So Nanay Elena, maybe you want to tell us something about your experience, no? Your
Yes po.
advocacy.
Sige po. Sige po. Siguro ikwento ko na lang kung paano ako napunta sa advocacy. Ako po ay dating OFW at 9 years po ako sa Middle East. Pero in 1994 po, nagpa-medical ako dahil babalik uli ako. It turned out, yung doktor ay sinabing unfit to work. Yun po yung medyo mabigat sa akin bilang manggagawa at bilang single mom. Nalagyan ako ng label na unfit to work because of HIV. So dahil denial ako, nag-try ako mag-second opinion. Naririnig po ba ako? Pasensya na po, nandito rin po ako sa session hall ng kabilang.
No problem po, we can hear you.
Nag-second opinion. Sige, nag-second opinion po ako sa ibang clinic and it turned out non-reactive. So sa madaling sabi, nakaalis po uli ako ng 1994 December at nakapagtrabaho uli ako sa Middle East, sa Dubai po. Pero after a month, kailangan ko pa uling magpa-medical at doon po ay pinabalik ako ng hospital at sinabi na meron akong slight virus. Wala pong information. Doon po sa medical sa Pilipinas, wala rin pong pre and post test na counseling. So wala kaming information. Ako, individual, wala akong information about HIV. Napag-alaman ko lang siya sometime nung nandun ako sa ibang country. Ang pagtingin sa kanya ng Arab country ay killer disease ang AIDS. AIDS pa yon, hindi pa HIV. So ganun ko siya nakilala. So nung ako ay na-diagnose doon, kailangan akong i-deport. So pinonoses yung deportation. Pero ang hindi ko po matanggap ay yung hindi na ako makapagtrabaho dahil ako ay single mother. So nag-try po ako dahil sa depression, anxiety, wala akong nakakausap tungkol sa aking sitwasyon. At ang pag-iisip na ako ay i-deport, nag-try po ako magpakamatay nung panahon na yun. Uminom ako ng sangkaterbang antibiotic kasi gano'n naman ang mga OFW, nagbabaon ng maraming antibiotic dahil masanay kami doon sa self-medication kasi mahirap magpa-ospital sa ibang bansa. So sa madaling sabi po na na-survive naman ako ng aking mga kaibigan. So ayun, ang nangyari ay deported na talaga. Pagdating ko ng Pilipinas, binalikan ko yung clinic kung saan ako unang na-test na positive at dito sinabihan ako na dapat ay schedule for counseling pero mas tumatak sa isip ko yung sinabi ng doktor na you are going to live 5 to 10 years from now. So yun yung medyo masaklap sa akin kasi iniisip ko nga nagpapakamatay na nga ako noon, hindi pa ako natuluyan. Tapos ngayon nilagyan naman ako ng label na unfit to work, tapos nilagyan pa ako ng taning ng buhay. So medyo mabigat po yung pinagdaanan ko talaga noong panahon na yun. So mula po noong sinabihan ako ng gano'n, hindi na po ako nagbalik sa aming ospital, sa RITM. Nung panahon namin, hindi po kami nagkikita-kita, yung mga PLHIV. Kailangan 5 meters away bago ka, pag alis ng isang pasyente, bago ka makakapasok sa clinic. At yun, mula po noon, hindi na ako nagbalik. And sinabihan ko na lang sa sarili ko na we'll just wait for my time. Kung 5 to 10 years, then be it. Ang tangi ko na lang dasal noon ay, Lord, give me the longest term para lang masigurado ko na mabubuhay ko yung aking 4 na anak sa abot ng aking kaya. So, to cut the story short, bumagsak po ang aking immune system in 2006. Nagkaroon ako ng myoma. Dito ni-refer ako sa isang hospital. Dito ko naranasan, nalagyan ako ng label na ilagay na lang daw sa aking record na HEPA kaysa ang HIV kasi mas tanggap ng community ang HEPA kaysa sa HIV. Pero last minute, kailangan pa rin i-disclose si HIV na kung saan dalawang doktor yung nag-deny na operahan ako ng myoma. So nakakaiyak at doon dumanas uli ako ng matinding depression. May gamutan na, meron ng free antiretroviral, pero dahil sa HIV, dalawang doktor yung tumanggi na operahan ako. So napakasakit yun bilang babae, bilang nanay, na gusto pang makasama yung mga anak. Meron ng libreng gamutan. Pero eto, di ba, masaklap na yung mga doktor pa, yung aking mga service providers na inaasahan ko na magdudugtong ng aking buhay, ay sila yung tumanggi na operahan ako. So sa madaling sabi po, dumanas na naman ako ng depression. At the same time, ni-refer naman ako sa PGH. Kaya mahal na mahal ko po ang PGH. Napakagaling po ng serbisyo ng aking doktor doon. Pero dito ko naman po naranasan na ipagsigawan, eto yung may AIDS. Pinandirihan ako ng mga tao dahil narinig yung sigaw. Kaya nang nangyari ay kinatakutan ako ng mga tao. Nilagyan pa ako ng label na universal precaution. Anong ibig sabihin ng universal precaution? Kahit ako, sa sarili ko, hindi ko alam kung ano yung universal precaution. Ang alam ko lang yan ay isang babala para sabihin lang sa mga tao na ako ay immunocompromised. Pero siyempre, sa ibang tao, ano ang pagtingin nila? Bakit may label na universal precaution? So yung mga ganung karanasan ang nag-udyok sa akin na mag-involve sa community. So noong 2007 kung saan tuluyan nang nasira yung aking immune system, dito ko na rin nasubukan o ibigay sa akin ang antiretroviral. So for 13 years wala akong antiretroviral. So noong 2007 nag-start ako, doon ko naman nakita na yung iba't ibang mga support group at nakilala ko na rin yung iba't ibang mga ahensya na nagbibigay ng mga capacity buildings para sa mga PLHIV. Dito ako natuto ng public speaking, dito ko natutunan ng advocacy, mga stigma and discrimination, at mga iba-iba pang mga counseling. So yun po, sa ngayon po ay isa ako doon sa nag-push ng pagbabago ng batas. Kung noong araw si Sarah Jane Salazar ang isa sa nag-push ng RA 8504, ngayon naman po si Nanay Ellen yung isa sa tumulong sa pag-push ng RA 11166. Pareho po kaming taga-Pasay at pareho kaming woman living with HIV. So yun po, sa ngayon po ako po ang founder ng aming grupo, yung Association of Positive Women Advocates Incorporated. And at the same time din po, ako ay kasalukuyang convener ng Network Plus, na kung saan ang Network Plus po ay samahan ng mga PLHIV support group dito sa buong bansa. So yun, medyo mabigat po yung tungkulin ko bilang ina ng community. So pero hindi ko pa rin po maiiwanan ang aking grupo, which is the support group of women living with HIV. Marami na po kaming mga bago at magagandang istorya patungkol sa mga kababaihan na namumuhay ng may HIV. Ilan na po sa hanay namin ang nanganak na normal delivery. Yun, no? Dati kasi CS lang siya. So ngayon ay meron ng nanganak ng normal delivery. Dahil undetectable na, marami na rin sa hanay namin na hindi nahawa ang kanilang mga partners kahit 15 years na silang nagsasama dahil undetectable. Ito yung binanggit ni Doktora kanina na U equals U. At marami na rin po sa hanay namin na nagbuntis at hindi po nahawa yung kanilang baby. Sipin ninyo, in 2011, 36 women nasa ilalim ng Prevention of Mother-to-Child Transmission. 37 women yon, isa lang po ang nag-positive na baby at hindi naglaon ay namatay. So ibig sabihin 36 na women, ang mga anak ay non-reactive. So magandang istorya na siya sa aming hanay. Sa ngayon po, yung pinakahuli ng anak noong pandemic, pinag-breastfeed po niya yung baby niya. Hindi po ito exclusive breastfeeding. Ngayon po yung huling test po ni baby ay non-reactive. So magaganda pong story yun para sa mga women living with HIV. Ibig sabihin po, malaki po ang epekto ng antiretroviral sa amin mga kababaihan dahil nasasagot din po nito yung aming mental health, yung aming mga multiple burden, lalo na yung mga babaeng merong anak at merong asawa na may HIV rin. So kung may multiple burden sila, medyo napapagaan ito dahil sa support group, sa aming psychosocial support na ibinibigay sa aming mga grupo. So yun po, sa ngayon ay
Yeah,
nasa
thank you
50 na
very
po yung
much.
member namin. Yun
Yes,
po.
thank you very much, Nanay Elena. Nakikita niyo po sa comments po kung nababasa po niyo. May mga nagpapasalamat po sa inyo for sharing your story. At maraming salamat for everything that you do for the community. Doc Raymond, baka you have some questions there in our Q&A box that you want to ask our doctors.
Actually, the question here, this one is from our regular, from Dr. Joseph Tortona. Has the government laid out plans to continue treatment of immunocompromised persons in the case of another pandemic? And maybe what are, not just, ano po, no? Not just HIV, but in general po, and how all of us could contribute towards making that happen. So we'll post that to Dr. Kate muna. Any government programs po with regards to that one, ma'am?
Yes po. So with regards po sa unahin natin yung supply of antiretrovirals, this is shouldered by the government. So wala po talagang kailangang isiping panggastos tungkol sa gamot ang ating mga people living with HIV. Pangalawa po, meron po tayong outpatient HIV and AIDS treatment benefit from PhilHealth na siyang tutulong din para magdagdag, mag-cover ng, kunyari, kailangan bumili ng gamot na hindi available sa programa. Kunyari, meron siyang special na gamot na kailangan. Other laboratories, immunizations. We are in conversations to increase this this package kung maaari, kasi kahit papaano kulang pa din sa mga pasyente natin, pero nararamdaman namin na meron talagang support. Marami po tayong mga treatment facility na public or libre, no? Mas nakararami ang public kaysa private, kaya hindi po, miski ang testing for HIV should be free. Ngayon po, pagdating sa other issues like kunyari prioritization of immunocompromised in case of let's say COVID, no? Nakita natin sa mga IATF guidelines na talagang pina-prioritize ang ating immunocompromised sa pila, no, sa pagkuha ng bakuna. Nagpapasalamat kami para doon dahil at least yung mga agam-agam namin na baka maging severe ang COVID sa kanila ay naibsan. So yun po, no, sana ay tuloy-tuloy ang suporta ng ating pamahalaan.
Thank you so much, Dr. Kate. A lot of folks kasi are asking, especially with regards to how they have been coping during the pandemic. Ano po ba yung mga pwede po nilang magawa? Although a lot of them also are asking in terms of support groups, mga ganun po, no? This question naman po comes from one of our Zoom attendees. So how can we tell if an HIV treatment is working, and how do we reduce stigma against people living with HIV? We'll ask that to Dr. Sybil. Bravo.
Regarding the stigma, nasabi nga po natin, no, we should educate everyone about the disease, no? Na ito nga isang STD, but there is treatment right now, no, to boost their immune system at ma-prevent po yung mga opportunistic infections, while the drugs cannot totally, no, zero out their viral load. Hindi naman talaga yan mawawala, may undetectable lang. It can help pa rin, no, na yun nga po yung ma-achieve na hindi sila maging infectious. Kapag dinidiscuss na U is equal to U. Pero nandiyan pa rin si virus, pero at very, very low levels. Regarding stigmas, really, we have to educate everyone na HIV ay isa lang siyang STD na katulad din ng Hep B, Hep C, na kailangan talaga mag-ingat tayo. At sabi nga po natin kanina, we should work all hand in hand para po ma-reduce ang increasing rates of HIV natin. So how do we reduce it? Education, plus of course testing. Kasi sa testing po, we will be able to identify itong mga patients, we'll be able to provide counsel to their families, offer testing to their partners and their families. And kung of course negative, we will be able to advise them, educate them on the proper preventive measures. Yun po yung way talaga para mag-decrease ng HIV. Meron pa pong isang area no na parang hindi lang ata natin na-mention, yung use po of pre-exposure prophylaxis po yung PrEP na tinatawag. And we are very lucky that we have now these drugs in our local setting. Kaya lang, ang alam ko, Dr. Kate, or correct me if I'm wrong, hindi pa ito talaga totally libre. No? We have Truvada in our setting. Kaya lang, I think the cost is about 1,500 pesos a month. So that would be about 50 pesos per day. So ito po iniinom ng mga those at risk of acquiring HIV, nga po yung mga partners sa mga HIV positive patients. They can take this on a once daily basis as long as they're sexually active. Kaya lang po, ito very, very successful tong strategy na to in reducing or preventing HIV among cohorts po ng mga HIV positive individuals. Kaya lang, ang alam ko po, hindi siya totally libre. It's being shouldered po by the partner or by the patient. Yun po isang area na kailangan nating i-educate or what we call this, i-disseminate na meron po tayong PrEP na available in our country. And of course, yung self-testing, sana po kung masamilan ito. Well, in other countries, for advanced countries, no, they have self-testing for many infections, including HIV. So ito rin po isang way no, to maintain their privacy, matanggal po ang stigma, and at the comfort of their homes. Yun po. And yun pa rin po, palawigiran telemedicine and ARV delivery services po, including, nalaman ko pa sa pasyente, paano mo kinukuha sa sagip yung gamot mo? Nung time na kasagsagan daw po ng COVID, kinu-courier ng sagip yung isa po nating HIV hub, yung mga gamot from PGH sa kanyang bahay. So patuloy lang po, we will be able to decrease the incidence of HIV.
Doktora, meron po akong good news para sa inyo. Ang PrEP po ngayon ay free. So meron pong mga partner na institutions who do provide free PrEP. Gamot yung free, yung mga ibang tests na may rapid test tayo, libre siya. So, pwedeng HIV test, HBsAg, and yung syphilis. So, ang iba money out na lang dun is yung creatinine. So, less than 100 pesos for a month of PrEP. We're hoping that, sana magkaroon din tayo ng some support from PhilHealth regarding this in the future. No? Medyo mahabang usapan pa yun. Ang isa pang good news ko sa doktora is lumabas na po ang ating updated testing guidelines. So DOH has signed 2 new guidelines, testing and treatment, fresh from the oven this year. Nandun na po ang ating HIV self-testing. So once we procure our kits, then it's another mode of testing. So yung mga opportunities natin to have different modalities ay nandyan para mag-bridge natin yung gap ng kawalan ng ating testing. Thank you.
Very good news po yung doktora.
AVP Rica, I think we have one more. Can we pull her in to the panel discussion?
Yes, I think we are being joined right now by the project director of Meeting Targets and Achieving HIV Epidemic Control, or EPIC. Please welcome to our Q&A si Ms. Bai Bagasao, Teresita Marie P. Bagasao. Ms. Bai?
Yes, thank you. Apologies for the late joining. There was some miscommunication with my medical provider, but I'm okay now. So I've listened to what more or less this last part, and maybe the one thing that I can add apart from what Doc Kate Leyritana was mentioning is in terms of PrEP, also maybe trying to simplify the delivery of PrEP, because to a large extent our communities, if they are engaged, actually help increase the initiation to this prevention measure, but also is a gateway to initiating treatment if they are found reactive, no? So importante yung participation ng community, and here it's not limited to just what we refer to as key populations, men who have sex with men, transgender women who have difficulty access to services, but even our community of people living with HIV, no? Kasi in the past, parang nakafocus din sila, rightfully so, in access to treatment. But now, I think if we are able to try to maintain or reach epidemic control, they have a significant role in also looking at prevention and promoting PrEP, as well as really coming for testing, just to know their status, so that they can be triaged either to prevention or to treatment, or if they're in between, what can they expect? Over to you.
Doc Butch, kanina, I have a question for you, no? Kasi kanina nabanggit yung lower ang regular condom use, no? Hindi po kaya because of the, yung iba, baka iniisip nila, nagpe-prep naman ako eh. Baka pwede nang hindi mag-condom. Ano po masasabi niyo doon, Doc Butch?
Siyempre, the more precautionary measures we take, the safer we are. No? Even if you're on PrEP, kasi there can be breakthrough infections. Like sometimes the drugs that we take, for some reason, the serum levels, they fall. Sometimes we fail to take our meds regularly. So it's always a good measure. No? Meron kasing, ewan ko, bakit there is a tendency for, siyempre, more of males, di ba, to use condoms. There is that, siguro, Filipino mentality din yon. And maybe hindi lang Filipino mentality. Pero sana matanggal natin ito. Yun ang isang kasi, no, of PrEP. Yun ang isang outlook. We need to warn people, hindi porke naka-PrEP ka, Superman ka na, no? Impervious ka na to. And besides, it's not just HIV. Diba? There are several other dangerous, also equally dangerous sexually transmitted infections that can be transmitted if you're not using barrier protection. So sana these are the messages that we try to put across.
Doc Raymond, do you still have some questions for our panel?
Just one more question here. And I think we've had, 3 people ask this question. As doctors, is there an ideal way or best way of delivering the news to a newly diagnosed HIV patient? Dr. Kate?
I think the overall theme of the delivery is hope. Okay, we are giving a diagnosis which will definitely change their life. So hindi natin pwede i-minimize yun na parang wala lang, inom ko lang ng isang pill a day. Kasi hindi natin binibigyan ng honor yung bigat ng impact sa kanila yon. And baka in doing so, isipin nila na hindi dapat ako maging seryoso. Kasi yung doktor ko nga sabi, wala lang yan eh. So there should be an equal reverence, no, for the importance of staying on treatment sa hope na hindi this will prolong your life, this will help you get back to your pre-diagnostic stage, but also providing information. It's a balance of knowing how much to divulge during that time, because many patients will zone you out. Kasi parang the fact lang na may HIV ka, wala na yan, white noise na yung iba. So if you think that your patient is not ready to accept more information, putulin natin, no? But the point is, keep them engaged. Know that they will find support in you. Be patient in answering questions kasi doon mo makikita yung balik doon sa'yo. Kasi naintindihan niya. Ang importante is maintindihan niya ano yung kanyang kondisyon at ano yung mga pwedeng gawin at ano alam niya na nandyan yung health provider ko, yung institution ko para alalayan ako. And encourage tayo na humingi sila ng support system. Mahirap dalhin itong sakit na to mag-isa. May mga pasyente na ikaw lang, doktor lang tsaka siya ang may alam. and it really helps. No, we have the one thing I'm happy about HIV in the Philippines is the number of support systems, be it individuals who want to help, informal groups, organized groups, and mental health advocates who volunteer their time. Meron tayong mga tinatawag na alter or yung mga anonymous accounts on social media na nandyan para magkausap lang, no? Alam natin na baka maaring sila rin ay PLHIV, pero dahil they want to pay it forward, dahil naranasan nila yung hirap na yun, at ayaw nila maranasan ibang tao yun, nandun sila para tumulong. So I'm quite happy with the community, and I hope that for those who are recently diagnosed, no, may mga maaaring tumulong sa atin. Just ask us and we will let you know where to get help. Yun lang po.
Thank you very much, Doc Kate. Doc Raymond, I think it's time to show the results of our fun quiz na.
Sorry, I'm also muted. Thank you so much. Can we have Slido on the screen din po? We have 4 questions. These 4 questions, obviously, I will state the question po, and then I will call on our experts so that our audience can hear them directly, the correct answers from you po. For question number 1, paano po ba nahahawa sa HIV? Dr. Sybil, correct answer po?
The correct answer is yes. All of the above.
Okay. Thank you so much. So blood transfusion, mother to child, needle stick, and sexual intercourse po. Thank you so much. For question number 2, nagagamot po ba ang HIV? Dr. Sybil po ulit.
Well, no, kasi the fact na hindi mawawala yung virus, pero marami pong gamot na makokontrol ng kanyang pagdami. So, no pa rin po ang answer.
Okay.
Majority got it.
Yes, ma'am. And then number 3, ma'am, also for you, when taking antiretrovirals, at what point are HIV patients most likely no longer infectious?
Mahirap pong. Siguro si Dr. Kate pang mas may
okay, sige. Dr. Kate?
po.
So, earliest suppression is around 6 weeks. Pero sa ating local guidelines, we encourage na mag-viral load na po at earliest 3 months. So 3 to 6 months magpa-early viral load na po. Kasi po dati 1 year. So ngayon we wanna check as early as possible. So we can do something if it turns out na hindi siya UD. So maybe 1 month.
Okay.
Nearest to 6 weeks.
Opo, yung sa guideline namin sa OB, diba, pwede pong mag-normal delivery kapag mababa ang viral load. Kapag sila po ay naka-HIV drug for at least 4 weeks or 1 month. So, more or less, ganun nga po.
Okay. And then finally, for Dr. Kate also, bihirang magka-HIV ang mga babae. True or false?
Ano ba yan? Depende sa konteksto. So false, I wanna say, no? Makita nga natin, no, sa ating Sub-Saharan Africa, majority ng kanilang HIV cases ay kababaihan. So hindi po siya bihira. Sa Pilipinas, kaunti lamang, pero hindi po natin alam ang underlying reason nun. No? Maaring underdiagnosed o lang ito. So it's a challenge for us, no, to know the real score.
Thank you, Dr. Sybil and Dr. Kate, for answering our fun quiz po, and hopefully our audience were able to capture the correct answers. Before we proceed to your final messages, please take the time while I'm going through the panel discussion po, no? Please take this time to formulate your last messages to our audience, all of our speakers and reactors po who are invited. As I go through these 5 questions, 4-point Likert scale po siya. For each question. Number 1, the panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Next, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. We will not be closing this panel discussion poll or evaluation poll until the end of our webinar. Also, please take note that we do not have a separate evaluation poll. Bale, ito na po iyon, and we hope and encourage everyone to participate by keying in your evaluation of our webinar. So, but before all of this, let me take this opportunity to thank and show our appreciation po to our guest speakers making the time in their very hectic schedules to be with us today. Maraming salamat po sa inyo. Thank you. Over to you, Rita.
Yes, so before we end our Q&A session, may we ask for the parting words from each of our panel for our viewers. Let us start with Ms. Teresita Marie Bagasao. Ma'am Bay?
Thank you very much for this discussion. Actually, COVID did set back our response to HIV, but we also learned a lot about how to mitigate, the challenges posed by COVID to the HIV response. So we are not yet close to our 95 goals, but hopefully we are picking up with the joint efforts from the medical community, our community workers, as well as our communities of key populations and people living with HIV. So sama-sama, hopefully maabot natin yung 95 by 2030. Over to you.
Okay, thank you po. Can we now hear from Dr. Ricardo Manalastas Jr., si Doc Butch?
Like any other problem, if we work together, di ba, COVID, HIV, if we work together, we'll overcome all of this. So, yun lang siguro ang message ko. Thank you.
Thank you po, Doc Butch. Can we hear from Dr. Kate Leyritana?
Thank you po. Ang aking message po is, maaaring meron po tayong mga mahal sa buhay, katrabaho, kakilala na merong HIV. Maaari po tayong maging support system nila kung tayo po ay magpakita ng understanding and acceptance, and we can be one of their inspiration, no, para magpatuloy sa kanilang healthcare. Simulan po natin ang pagbawas ng stigma and discrimination sa ating mga sarili, sa ating closed circle, family. Let's talk about HIV, put it out on the table, and who knows, every one of you guys can actually save a life. Thank you.
Thank you, Doc Kate. And lastly, can we hear from Dr. Sybil Lizanne R. Bravo? Doc Sybil.
So together po, if we work hand in hand together with the LGU, na sana po ma-convert ulit back to mga HIV testing centers, HIV care centers, government sectors, and of course mga private institutions po, and some civil service sectors, we can all work hand in hand to decrease po yung ating rising epidemic. At sana po in the next 2 or 3 years, we won't be tagged as the country with the highest epidemic in Asia with regard to HIV infection.
Maraming salamat, Doc Sybil. Thank you very much to all our doctors. Doc Raymond, baka you want to share the panel discussion evaluation results po natin.
Thank you so much. So for our 5-question evaluation poll, at least 95% of all of our survey or evaluation poll participants indicated that they strongly agree and they appreciate it very much. All of the learnings you will also see in the chat. This has been one of our more informative webinars po, and shining a spotlight on a topic that's not so much talked about in the mainstream. So thank you po sa lahat ng ating speakers for today. For our closing and for our synthesis po, as part of our webinar, we will be remiss if we did not hear from our Chancellor at the University of the Philippines, Manila, Dr. Menchit Padilla.
Magandang hapon po sa inyong lahat. Today's webinar addresses an epidemic from the pre-pandemic times up to the present, and that is HIV. Our first speaker is Dr. Bravo, and she started by saying that HIV is a virus that attacks the immune system, specifically the white blood cells called the CD4 cells. It weakens the person's immunity against opportunistic infections like TB, fungal infections, severe bacterial infections. And if left untreated, HIV can lead to the disease AIDS or acquired immunodeficiency syndrome. The risks are things we know. It included multiple sexual partners, unprotected sex, the presence of STDs, the sharing of contaminated needles, and the transfusion of HIV-infected blood. The symptoms are protean. It may be nonspecific. Dr. Sybil discussed the 3 stages of HIV. Stage 1, HIV in the blood. Some may be symptomatic, some are asymptomatic. Stage 2, the chronic HIV infection, where it can be latent and the patient may be asymptomatic. And we have stage 3, which is AIDS. As for diagnosis, anybody at risk must be tested. And I want to give the special mention when she said that test, practicing the 5 C's: consent, confidentiality, counseling, issuing correct results, and connecting them with services. The diagnosis of HIV must be offered to all needing the service. So I'd like you to watch the replay and learn the ways of HIV testing and the techniques of disclosure. I do want to mention the steps for the prevention of mother-to-child transmission. 1 is antenatal testing, 2, anti-retroviral treatment, safe labor and delivery, safer infant feeding, exclusive breastfeeding for the first 6 months, the early infant diagnosis, and 6 will be the final diagnosis soonest. We've heard that there is no cure, but the goal of management is to prevent the further deterioration of HIV. The Philippines follows the WHO guidelines for treatment, starting with the start of the anti-retroviral therapy upon diagnosis. Dr. Sybil ended by reminding us that HIV is fast growing in numbers, but hidden. There are 1,300 new cases per month, and we should really keep this in mind. And this has been aggravated by the disruption in service, especially during the COVID times, and the sustained high-risk behavior. Our next speaker is Dr. Kate, who focused in women. She started by saying that globally there are 20 million girls and women with HIV, mostly from the sub-Saharan Africa, majority in the ages 15 to 24 years old. But in the Asia Pacific, there are more males than women. And in the Philippines, the women comprise 6% of the new cases just in July. And the females represent those diagnosed at pregnancy. I found it interesting when Dr. Kate shared the beginnings of HIV in the Philippines, because in the 80s, there were more women than men. And then in 2007, there was a flip. The new cases were mostly male, and now 95% are males. And for the women, 96% were in the reproductive age at the time of diagnosis. Dr. Kate gave a lot of interesting data, local data. And as a matter of fact, she had a survey on 53,000 respondents. And I really urge you to watch the replay and learn more about cases, globally and then locally. I do want to mention the issues of gender and inequality. And there was a perceived lack of awareness of HIV among Filipino women because, because those who were not direct targets or prevention strategies are less inclined to undergo HIV testing. Second, the females usually present late. 3, there is a feeling of seclusion and self-stigmatization. 4, the women had lower treatment initiation. And 5th, the inequality is that they are motivated by the responsibility to survive and to live longer for their families. She gave a spotlight on the female sex workers. And I think, just to learn this information that the first vaginal sex is at the age of 18 years, unprotected with condom use 2 years later is really alarming. And it is interesting that towards the end of her conversation, of her discussion, she talked about the benefits now of better knowledge and testing for these women, so that now there are more and more women who are more protected during the sexual intercourse. The concerns, there are a lot of concerns, and I will not go through them. Not only gynecologic health issues, but a lot of mental health issues. If there is one thing that probably you should remember from Dr. Kate's presentation, is the U equal U. A person living with HIV who has an undetectable viral load does not transmit the risk virus to the partners. So she answered talk by giving us the cascade of care. And diagnosis, the cascade of care with the diagnosed case of HIV. 3 major things: access of females to education on the prevention, and as well as the prevention of transmission from the mother to child. Number two is the holistic quality of care. And the third one is the provision of support systems that's badly needed, whether male or female. Our reactor is Dr. Butch Manalastas, who highlighted the following. He started by saying, start with living a healthy life. Second is to get tested. Third is to remove the stigma that it is always due to multiple partners. He said that, in some cases, the female had only one partner. The next one is to avail of services. And the last point that he raised, which he highlighted in the open forum, is that we need multiple precautionary measures. Taking the pre-exposure prophylaxis is not 100% guarantee. Our other reactor is Nanay Elena, an OFW was diagnosed with HIV and was deported back to the Philippines. And aside from the feeling of denial, she shared the episodes of depression with the labels that were given to her. But she ends by saying that she continues to be a strong advocate to support the women living with HIV. Our speakers have emphasized that we must educate all, affected or not affected. There is no cure, but there are drugs that can prevent the complications or avoid the deterioration of HIV. So in the spirit of reducing the gap or removing HIV in the Philippines, then all of us must know about HIV because we can contribute to the reduction of stigma and also the cases of HIV. So once again, here is another epidemic that needs a whole of society and a whole of government approach. We may see the end of COVID, but HIV continues to be a challenge. Magandang hapon po sa inyong lahat and thank you for joining us.
Thank you very much, Chancellor.
Thank you, Chancellor. Thank you.
Always look forward to it. Maraming salamat po. Okay, so let's talk about our episode next week, Doc Raymond. Next week we're going to have COVID and children with cancer, no?
Yes.
We will have Dr. May Dolendo of the Children's Cancer Institute from the Southern Philippines Medical Center and Dr. Fatima Joanna T. Santos Ocampo, who is head of the Immunology Council of PSAAI, the Philippine Society of Allergy, Asthma, and Immunology, and advisor Philippine Organization of Patients with Primary Immunodeficiency, or PhilPOPI. And so please join us next week. We will continue this exciting series of webinars with Doc Susie. Doc Susie next week. Okay, go ahead, Doc Raymond.
Thank you so much, EVP Rica. Before we conclude our program, we'd like to acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out quality content each and every week. So maraming salamat po sa inyong lahat. Finally, all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel. Just go to youtube.com/TVUPPH for you to be able to see all 116 webinars, and then after today, it will be 117 po. This formally brings to a close our webinar for this week. Magkita-kita po tayo again next week, same time from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy. See you online.